You have probably heard of measles, but do you know how dangerous it really is? Even today, also, one tiny virus, one sneeze, and hundreds can fall sick. This is the story of measles. The WHO had set the objective of eradicating measles globally using the live attenuated vaccine. However, vaccination of more than 95% of population is required to prevent outbreaks. Natural illness produces a lifelong immunity to measles. Clinical feature is infection is by respiratory droplets with an incubation period of 6 to 19 days. A prodromal illness occurs 1 to 3 days before the rash with upper respiratory symptoms, conjunctivitis and the presence of pathognomonic Koplik spots. The Koplik spots are small and white spots that occur on inside of the cheeks early in course of measles. As natural antibody develops, the maculopapular rash appears spreading from face to extremities. Generalized lymphadenopathy and diarrhea are common features. Complications are more common in older children and adults and include otitis media, bacterial pneumonia, transient hepatitis, pancreatitis, and clinical encephalitis. The clinical encephalitis is approximately found in 0.1% of cases. A rare late complication is subacute sclerosing panencephalitis, which occurs up to 7 years after infection. The diagnosis of measles is clinical, although this has become unreliable in areas where measles is no longer common, and by detection of antibody, that is serum IgM levels. In measles, CBC shows leukopenia with lymphocytosis and thrombocytopenia. Serum IgM test on third day of rash because it is not detected usually on the first 2 days. Serum IgG level is detected to be 4 days after rash. Measles is a serious disease in malnourished and vitamin deficient or immunocompromised patient in whom the typical rash may be missing and persistent infection with giant cell pneumonitis or encephalitis may occur. In tuberculosis infection, measles suppresses cell-mediated immunity and may exacerbate disease. For this reason, measles vaccination should be deferred until after commencing an anti-tuberculous treatment. Measles does not cause congenital malformation but may be more severe in pregnant women. Management and prevention. Normal immunoglobulin vaccination attenuates the disease in the immunocompromised patient and in non-immune pregnant women but must be given within 6 days of exposure. Vaccination can be used in outbreaks and vitamin A may improve the outcome in uncomplicated disease. Antibiotic therapy is reserved for bacterial complications and all children aged 12 to 15 months should receive measles vaccination as combined measles, mumps and rubella, which is known as MMR vaccine, a live attenuated vaccine, and further MMR dose at the age of 4 years. So this is all about measles, the clinical features, diagnosis, complications, management and prevention. Follow my channel for more such relatable content.